Hi, this is Alan, and I'm doing a oxygen checkoff for a nasal cannula setup. First thing I'm going to do is when I get the requisition, I'm going to gather my equipment. And I have a nasal cannula, I have a pulse oximeter, I have my watch, and my stethoscope. I would then proceed to the patient's floor, and I check the patient's chart, and I look for the physician's order, and then I would look for as to why the oxygen therapy was ordered. I'd look for the indication. Was there a low PaO2, low SaO2, low CaO2, or were there some physical signs of shortness of breath, or was there possible patient exposure to carbon monoxide poisoning? After that, after I found the indication, I'd make sure I'd look at the rest of the chart, respiratory notes, nurse's notes, progress notes, see if there was a chest x-ray, and at that point I would identify my patient, make sure I had the correct patient name, patient identification number, medical record number, and when I knew that I had the right patient and I was delivering the right therapy for the right reason, I would proceed to the patient's room. And the first thing I would do is knock on the door. Hi, my name is Alan, I'm from Respiratory Care, and your physician has ordered some oxygen for you to help you breathe a little bit better. And your name is?
Savannah Hatch.
Savannah Hatch, okay, great. First thing I'm going to do is I would wash my hands before touching the patient. If I use an alcohol-based hand rub, I'm going to have to make sure that I get it all around my hands, and then they have to air dry. You do not want to dry them with a paper towel or anything, they have to air dry. Now, I would move this table out of the way, and I would first check my patient's ID, and it's Miss Hatch, and your date of birth?
4/28/89.
4/28/89. Okay, great. And Miss Hatch, how do you feel right now?
I feel okay right now.
Feeling okay right now? Well, the doctor felt that you needed some oxygen. I'm going to take listen to you, and I'm going to check your vital signs. Have you been experiencing any kind of shortness of breath? None at all? Okay. Any kind of chest pain or anything? No? Okay. At this point, I would explain to the patient as to why they're being placed on oxygen, and also some of the things that they need to be aware of while being on oxygen. Since you will be placed on oxygen, I need to make you aware of that if you start feeling lightheaded, dizzy, nauseous, you start feeling kind of tremors or anything like that out of the normal, I want you to tell your nurse so they can tell me and they can come back and I can reassess you. Okay? Don't be nervous about it, but sometimes some patients have that feeling, but very few. Okay? The other thing too I need to make sure that you realize is that while you're wearing oxygen, you cannot smoke. No smoking whatsoever. And the hand lotions that you use or facial lotions, make sure you check with the nurse first before using them. And I would like you to limit your electronic device usage while wearing oxygen. But the reason is that anything that could burn in room air will burn hotter and faster in the presence of pure oxygen, and that's what I'm giving you.
Okay.
Okay? Do you understand what I'm saying?
Yes, I do.
Okay. Do you have any questions for me?
I do not.
Okay. And at this point, if there were family members in the room, I'd ask if the family members had any questions. I'd also ask the patient if the family member could stay in the room, but there are no other family members in the room at this time. At this point, I would check the patient's heart rate, respiratory rate, sat, color, level of dyspnea. Heart rate I'd check by getting a pulse. Respirations, I'd look at the patient. And I'd count for 15 seconds and I multiply that by 4. I'd get her saturation by using what we call a pulse oximeter. And the pulse oximeter actually measures the saturation of the hemoglobin molecule. So as long as she's not wearing nail polish on her fingers, and she has good perfusion in her hands, and she hasn't inhaled carbon monoxide, this should be a fairly accurate test. Will not be perfect, but it should be pretty accurate. Okay, I see that her saturation says that it's 88%. So I've got the heart rate, the respiratory rate, sat, I'm looking at her color, and I'm checking her level of dyspnea, which she said was fine. At this point, I will go ahead and set up my equipment, which is the nasal cannula. I'd make sure my flow meter was hooked up into the wall. And now I'm going to use air because we're in a room that only has piped in air. And I check. Actually, I'll use the oxygen. And I check and make sure that it's working, and it's working at 2 liters per minute. And I turn it back off. I show the patient the nasal prongs and the nasal cannula. You see those 2 little prongs there, Miss Hatch?
Mhm.
Those prongs will be sitting inside of each side of your nose, and it'll be providing oxygen in a low flow. I want you to kind of feel the flow. Okay? Now at this point, since the patient has felt it, I will go ahead and place the nasal cannula on the patient. Not all your patients are going to be this cooperative as she is. And now I would slowly increase my liter flow until I got to 2 liters per minute. You doing okay with Miss Hatch?
Mhm.
Okay, good. Okay, now she's at 2 liters per minute, and I'd say, how do you feel?
I feel fine.
You feel fine? Great. Okay, again, I have to reiterate, no smoking whatsoever, nothing with any kind of flames, okay? Limit your use to electronic devices, and if you want to use any kind of lotions or oils, hand oils and stuff like that, you need to check with your nurse first, okay?
Okay.
If you start feeling dizzy, nauseous, lightheaded, any kind of tremors or anything, what should you do?
Let my nurse know.
Let your nurse know. Okay. At this point, I'd reassess my patient again, check her heart rate, respiratory rate, sat, color, and level of dyspnea. And if I needed to, I'd make adjustments. If she had no other questions for me, do you have any questions for me?
I do not.
Okay, we come back and we check every 8 hours. I'll check on you again. If you need me, just call your nurse. Okay? Okay, and at that time, I would go ahead, wash my hands again. I'd leave the room, make sure that there was a no smoking sign posted on the door, oxygen in use, and then I would go ahead and chart.